If you or someone you love has been diagnosed with age-related macular degeneration or AMD, chances are you've been advised to take an eye vitamin to slow the progression of the disease. So, what is the difference between an eye vitamin and a regular multiple vitamin? And with so many different eye vitamins on the market, exactly what should you be looking for so that you can choose the best one? Today, we'll be answering those questions. Good morning, health-minded people. I'm Dr. Snow, and I help you treat minor health issues naturally, and I work with clients and their physicians to make sure that they are on the fewest medications necessary to ensure the best outcomes possible. Age-related macular degeneration, also known as AMD, occurs in people usually over the age of 60, but sometimes younger. It is a disease of the eye that causes progressive damage to a part of the retina called the macula and can lead to impaired vision and possibly blindness. So, what about these eye vitamins that your eye doctor wants you to take? Are your multivitamins good enough? Maybe, but maybe not. The Age-Related Eye Disease Study, or AREDS, was started in the late 1990s and was followed by the AREDS 2 study. These studies look at diseases of the eye in older patients, including macular degeneration and cataracts. The outcome of these studies included a nutritional supplementation recommendation to help slow the progression of the disease in patients with intermediate or worse macular degeneration by up to 25%. The vitamins do not prevent or slow the progression of AMD until it gets to the intermediate stage. In the original study, vitamin A was included in the form of beta-carotene, but it was found that this increased the risk of lung cancer in smokers and in former smokers. So in the AREDS 2 study, the beta-carotene was removed and lutein and zeaxanthin were added. It turns out that vitamin A doesn't help slow the development of cataracts, but lutein and zeaxanthin do. But that's another video. Both formulations can slow down the progression of macular degeneration, but stay away from high doses of vitamin A if you've ever been a smoker. Other vitamins that were included in the supplement during the study include vitamin C and vitamin E. Copper was also added in the second study because zinc decreases the absorption of copper, an essential mineral that does not affect the progression of macular degeneration, but deficiency of copper may cause frequent illness, weakness or fatigue, cold sensitivity, and difficulty walking. Because of the decreased absorption of copper and other nutrients, and because too much zinc may actually destroy retinal cells, it has recently been suggested that the amount of zinc should be decreased from 80 milligrams daily to 25 milligrams daily, and studies are showing no decrease in benefit for macular degeneration. Too much zinc has also been linked to decreased immunity to infectious disease and may decrease HDL, the good cholesterol. It may also increase the risk of urinary tract infections, especially in women. So, as with everything else in life, there is a balance between too much and too little zinc to keep us healthy. If you're learning something from this video, please hit that like button. The current recommendation for an eye vitamin that can help decrease the progression of macular degeneration includes 10 milligrams of lutein daily, zeaxanthin 2 milligrams, vitamin C 500 milligrams, vitamin E 400 international units, zinc oxide 25 milligrams, and cupric oxide or copper 2 milligrams. If your multivitamin contains ingredients in these quantities, it may be adequate to protect you from progressing from intermediate macular degeneration. However, many eye doctors are telling their patients to take their eye vitamins with their multivitamin to ensure protection. Ask your doctor what his or her recommendation is. Also, it should be noted that eye vitamins are available over the counter and will probably not be covered by your insurance. And depending on the product, they may cost you anywhere from $10 to $50 a month or more. When choosing an eye vitamin or any vitamin, check with the company and ask if they do third-party testing to ensure that what is on the label is in the vitamin. Vitamins are not considered medication by the FDA, so specific products are not regulated as medications are. The manufacturer is expected to regulate themselves to ensure that what they report on the label is actually what is in the product. The most reputable companies will have third-party testing done to obtain an unbiased report on the product. This testing is expensive, so the cost is passed on to the consumer, which is why a good quality product will always cost more. But isn't your eyesight worth it? And while they won't usually be covered by insurance, check to see if you can use your health savings account to cover the cost. If you have a prescription from your physician, you may be able to use your HSA. If this video has been helpful, please consider subscribing to my channel. And don't forget to hit that little bell so that you'll be notified every Monday when I post a new video that's designed to help you navigate the sometimes confusing healthcare system. The most important way to prevent the progression of macular degeneration and potential blindness is to catch it early. Everyone should have their eyes checked every 2 years until you are over the age of 60. After 60, you should have your eyes checked each year or as often as your eye doctor suggests to catch and manage any problems early. If you have found this information helpful but want more information on vitamins and nutritional supplements, I have created a series of videos that can help. Click and watch here now. Thank you for joining me today to learn about the vitamins used to slow the progression of macular degeneration. Stay healthy, see your eye doctor regularly, and have a blessed week.